name is Yesenia Cuello. I'm the executive director of NC Field, which is short for North Carolina, focused on increasing education, leadership, and dignity. So we're a grassroots nonprofit organization that works alongside farmworker and rural communities all across Eastern North Carolina in order to strengthen access to, of course, access to health, behavioral health, and other social support systems. So the connection that we have directly with NC Counts and NC Field is that we're rooted in, I think, very shared, like a lot of shared values, especially whenever we start talking about things like the importance of collaboration, the importance of community leadership, the difference of what it looks like to be community focused and to truly allow ourselves to be community led. And I think at the very end of the day, our collaboration allows us to ensure that a lot of like the realities for rural communities and rural voices and rural stories are part of the decision-making work that is happening across levels and across sectors. Because NC Field, although we're a community-based organization, the spaces that NC Counts is in isn't always one where we have a physical presence. And though we know that we can count on NC Counts to make sure that y'all are elevating the realities of how behavioral health uniquely impacts immigrant communities, farmworker communities, and rural residents, especially in Eastern North Carolina. The Behavioral Health Task Force is probably one of the only, if not the main task force that we are a part of that specifically addresses behavioral health. I was like, so I think that that's been one of the unique things because this space is also fairly new for us. I was like, whenever it comes to behavioral health. So this is an opportunity where we get to learn and we get grace in asking questions. But people that are coming to the table are really wanting to help. I think the fact that we are even coming to the table acknowledging that we can't do one without the other. I was like, professionals can't address this work without bringing together community voices, and lived experience. I was like, because I think that piece has historically been missing. I was like, so I do completely think that this is still worth our time. And I do have hopes. I recognize that this is not going to be a quick fix solution. And though I never intended it to be, because the goal is that we're going to be intentional and we're going to strategize and we are going to put in the work to make sure that what we're proposing or what we're doing together will impact the community. One of the biggest requests that we have for community, if they could ask for anything, it's just for their humanity to be acknowledged. In my head, I'm like, you're not asking for too much. I was like, but I do believe whenever they say it, like I do think it would be harder for systems to do what they do to people like the ones that are in my community if they even looked or acknowledged their humanity. So I think NC Counts is in a position to make sure that the things that are being introduced and proposed make some sense and are relevant to what we need and is done with our communities in mind. I was like, because historically it hasn't, and the reality is that I can't be everywhere. I was like, the people on our team and the community health workers at different community-based organizations, like, yes, there is a capacity challenge, and though we don't have to be everywhere. And to be honest, there is a sense of relief knowing, like if I'm looking at something and I'm like, oh my goodness, we have to be there. I was like, oh, NC Counts is there. I was like, I don't have to be there. I was like, because you're an extension, I was like, of the voices and the realities. And I was like, there's somebody at the table